So, you want to get into ultrasound school. Before you apply anywhere, there's something most applicants don't realize. Some ultrasound programs accept only 10 students per year, which means hundreds of applicants are rejected before they even reach the interview. Not because they aren't smart, but because they don't understand what programs are actually looking for. So, in this video, I'm going to show you exactly how people get accepted into ultrasound school and the mistakes that cause many applicants to get rejected. Welcome back to the Echo Classroom. My name is Minx Karoma. I'm registered in cardiac ultrasound, abdomen, OBGYN, and vascular ultrasound. And on this channel, I help students understand ultrasound and echocardiography with clarity and confidence. So if you're interested in ultrasound, consider subscribing because here in the Echo Classroom, our goal is simple: to make ultrasound make sense. Before we talk about the steps to getting accepted, I want to share something personal. The reason I became interested in ultrasound was because I lost my younger sister to cancer. After she passed away, I knew I wanted to help people, but I also didn't want to spend the next 10 years in medical school. So I started researching careers in medicine, and that's when I discovered medical ultrasound. And honestly, it turned out to be one of the most rewarding decisions of my life. Now, don't get me wrong, ultrasound school was not easy. There were many late nights studying, and some of the classes were extremely challenging, like physics and OBGYN, for me personally. But I worked very hard, and I was fortunate enough to graduate magna cum laude. And if I had to do it all over again, I absolutely would. Even with the challenges, the long days, and the physical demands of the profession, because helping patients through medicine is something I'm extremely proud to do. And in many ways, I do it in honor of my sister. Now, let's talk about the first steps of getting into ultrasound school. Many people become interested in ultrasound because of what they see online. It looks peaceful and fascinating. But ultrasound isn't photography. It's real-time medical problem solving. You're constantly adjusting the probe, adjusting the machine, and interpreting anatomy. Sometimes the image is clear and beautiful, and other times you're scanning through obesity, lung disease, surgical scars, or patients who are barely able to move. And you still have to figure out what's going on inside their body, whether you're able to see well or not. That's the part of ultrasound that people don't see. But if that challenge excites you, you're probably looking at the right profession. One of the biggest mistakes students make is applying to ultrasound programs without understanding accreditation. Not all ultrasound programs are accredited, and that can create serious problems later. The programs you want to look for are CAHEP accredited programs. CAHEP stands for Commission and Accreditation of Allied Health Education Programs. Why does this matter? Because graduating from an accredited program makes it much easier for you to sit for your national board registries such as the ARDMS and the CCI. And those credentials are what employers actually look for when they hire sonographers. Now, is it possible for you to get hired from graduating from a program that is not accredited? Yes, it just requires a few more steps that you may want to bypass. So before applying anywhere, check one thing: is the program accredited? That single decision can definitely affect the trajectory of your career. Most ultrasound programs require prerequisites before you can apply. These usually include courses like anatomy and physiology, college algebra, medical terminology, and physics. Some programs may also require healthcare experience. Every school is slightly different. That is why it is extremely important and a wise strategy to research multiple programs very early on. Look at their prerequisites, then complete those prerequisites before application season begins. Students who plan ahead here usually have a much stronger application. This is another area where many applicants struggle. Ultrasound programs want to know that you understand healthcare environment, because ultrasound isn't just technical, it's also patient care. Some programs even ask applicants, have you ever observed a sonographer before? So gaining some clinical exposure can help tremendously. Some good examples include shadowing a sonographer, working as a medical assistant, or volunteering at any hospital, and making sure you put in the work. It is also acceptable to have previously worked as a patient care technician. Even a small amount of experience shows programs that you understand what healthcare looks like. If your application is strong, many programs will invite you for an interview, and during that interview, schools are trying to answer one important question: will the students succeed in this industry? They may ask, why ultrasound? How do you handle stressful situations? And even, what do you know about this profession? They're not looking for perfect answers. They're looking for students who are curious, motivated, and serious about the field. Ultrasound is one of the most fascinating careers in medicine. Every day, you're looking inside the human body. And sometimes you're the first person to discover something that could save that patient's life. But getting there takes dedication, and that starts with getting the application process right, by understanding how the application process actually works. In the next video in the series, we're going to talk about something many students are not prepared for: what ultrasound school is actually like once you get in. Because the reality of ultrasound training is very different from what people expect. So if you're serious about becoming a sonographer, make sure you subscribe to the Echo Classroom, and I'll see you in the next video.